Last year, not just one, but 7 unvaccinated travelers diagnosed with measles entered our county between October 1st and October 17th, leading to 153 confirmed cases. And this is the longest outbreak in the U.S. due to measles since the disease was officially eradicated in 2000.
That was Rockland County Executive Ed Day declaring a public emergency in the New York City suburb. Yesterday, the county takes an unprecedented step of banning minors who have not been vaccinated from measles from any public spaces within the county. This after 153 cases have been confirmed in Rockland since just October. Joining us right now, Dr. Mikhail Varshavski, also known as Dr. Mike. Good to see you, Dr. Mike.
Good to see you.
What's going on with the measles outbreak?
Well, what's happening is there's a lot of misinformation floating around very specific communities, and one of these biggest communities in the United States happens to be in Rockland County. You said there's 153 cases. That's been going on since October. This year alone, there's already about 50 cases. So I'm really proud that Rockland County is taking steps, not only preventing these children who are not vaccinated from attending school, but also trying to limit this spread, because measles spreads like wildfire. Wow. If someone who is not vaccinated is exposed to someone who has measles, 90% likelihood they will catch it. So this isn't something that they're taking lightly. They don't want this to become an epidemic where the entire county is covered in measles, because people will die. Before the vaccine was around, 450 people a year would die as a result of measles. We should not be having this in the United States when we have a vaccine that, if taken properly, works 96% of the time.
Mike, just say it directly, because for some reason this is not getting through to people. The vaccine is safe. Parents need to vaccinate their children. Just say that.
This has been said multiple times over. Vaccines are safe. They need to be given. Vaccines do have side effects, but those side effects are not nearly as equivalent to the danger if you get measles, and can result even in death.
Well, you're saying
that's scary.
The side effect isn't autism.
Yeah, the autism.
That's where the anti-vaccine crowd. That was what they were hitting on. And by the way, these individuals were allowed to go on TV and radio and basically spread this garbage for years and years and years. And so to reverse that is going to be difficult.
But if you got vaccinated already, like when you were a kid, you can't get it again, because some people get booster shots, right?
Yeah,
Tell us about that.
What you can do is, if you feel that you're going into a high-risk community, so for example, if you're going into a healthcare setting, you will need to get titers to prove that you're still immune. But generally speaking, if you got your proper vaccinations as a child, you are immune to measles, and that immunity should not be waning.
But a titer is it's a blood test to find out if the antibodies are still present to fight the disease.
So, Dr. Mike, looking into this Rockland County sort of public place ban, right, so where it still allows people who are unvaccinated to go as public parks, why did they allow folks to go to public parks but not go to schools?
That's a really interesting point. I didn't know that it was specifically around public parks. I know that they really focused on areas where people were in a confined environment. For example, malls, where people will be in close proximity, they'll be sneezing, they'll be touching the same objects. In a park where it's an open space, there's less likelihood of contamination, so that could be one of their thought processes.
Mike, what is the law around restricting people for health and safety?
Well, the law comes from Judge Knapp will probably be a better person to ask
yes.
that. But I think that the way that they're making this happen is by creating an emergency session where they're saying, because this is a public crisis, there's an emergency going on, we're going to institute this policy, and they're only instituting this for a period of 30 days. And it's not like they're planning on putting people in jail for this. They really want to use this as a way to show people how serious they are and why we need to get this under control quickly.
What about this, the male birth control pill, now closer than ever, according to the Endocrine Society?
Well, you know, it's funny because there's been a lot of push to make this happen. But the question will become, will men actually want to take this medication? Polling data shows that it splits somewhere down the middle. 50% would like to take it, 50% won't. This initial study was just looking at safety profile of the medications. It found that all of the patients that were involved in the study could finish the study, so none of the side effects were too intense. However, the medication will still be at least 10 years away. This isn't something that's coming on the horizon in the next year or two. And there's still a lot to be done. There's a lot of work to be done.
All right. We will leave it there. Dr. Mike, great to see you.
Thank you so much.
Thank you so much.